Welcome back. For many, doctor's visits are a routine item on the checklist, but things can often slip through the cracks in between appointments. Rachael Rivero from Kansas Care Connect is here on this Wellness Wednesday with some tips for those gaps between care. Rachel, thank you so much for being here.
Yes, of course, my pleasure.
Of course. So we have a lot to dive in today, but first, I just want to ask, what do you do for the community?
So I started a company called Kansas Care Connect, and we help provide care coordination services between office visits for people who are enrolled in on Medicare. So those who are, seniors, and then those with chronic conditions that are on disability, things like that. So we just help simplify and connect dots in healthcare between those office visits that people are used to.
Yeah, and I know going to the doctor can sometimes be very overwhelming just because, they ask a lot of questions, just a lot to expect for. So what do you kind of do to kind of ease that burden for people?
So we just provide a lot of personalized support. We work within the existing medical providers that they have. So we get records and we communicate with them as needed. So we can kind of be that one source of communication and support for people. We always encourage them to call us first. Of course, it's always whatever they're most comfortable with. But they can kind of call us first, and then we're support that doesn't really go away. When you go to the doctor, you're at the doctor's office, and then you leave, and then you don't really talk to them until you go back. It can be difficult to get a hold of people on the phone between visits and stuff with all the automated phone call systems and things that everybody has, whereas they can call us and we can kind of answer those questions that you always think of after you leave the doctor's office, or address any concerns that come up between there. And so they have a dedicated nurse and a nurse practitioner team, so we can help kind of navigate those challenges that come up and then coordinate back with their providers so that when they go back to the next office visit, they have what they need, they know what's been going on, everything's kind of kept up to date, and everyone knows what everyone else is doing.
Yeah, I know you mentioned that a little bit about why it's so overwhelming, but what do you think is just like the hardest bit for patients?
Nowadays, a lot of people have not just their primary doctor, but they have multiple specialists. So there's a lot of confusion sometimes about, well, where do I start if I have a question or concern? Who do I go to? Are they talking to each other? Sometimes they get multiple providers who maybe answer things a little bit differently and they're just not sure, or they feel like nobody's really looking at the whole picture. Yeah. And so we help with that. And then it's just things like if there's medication changes or they're not tolerating a medication, things like that, like what do I do? Do I just stop it? Do I keep taking it until I go back? What do I do? So we just help navigate those types of questions. And then we also help connect with additional resources and support if they need it.
Yeah, most definitely. And I wanted to ask before talking about those additional resources, what do you think just slips through the cracks when people are overwhelmed?
Oh gosh, a lot of things. There can be things like life gets busy and you miss an appointment, so getting it rescheduled. We were just recently at a conference talking with providers from all over Kansas, asking them what they see slips through the cracks as well, and that's a big one. Yeah. Getting those routine follow-ups, those routine screenings, keeping people healthy, but it's also keeping up with medication, say their refills ran out, and just getting that taken care of. And so having somebody kind of on the inside of the system that can help support them helps immensely.
Yeah, we all need a little extra help when going to the doctors.
We do.
And just very quickly here, what are those resources that people can reach out to?
Well, so our company, Kansas Care Connect, can help with setting up that whole coordination service. It's a Medicare covered service, so most people pay nothing for it. We just help connect the dots, and then when they're talking with us, we'll do an assessment to see are there any other community resources like support at home, food support, resources, extra services, things, whether they're paid or not paid, and kind of give more information about those and see if it works for them. And we get to know those companies and try to connect them with the best local company that's appropriate for their needs and their goals.
All right, sounds good. Well, thank you, Rachel, so much for being here.
Thank you for having me.
Of course. And hey, go check out those resources. We have them on our website at kake.com/guest. We also have the phone number there for extra support. In the meantime, we'll be right back.